The Kaiser Family Foundation presents health08.org, election news, analysis, and events.
Rich Umbdenstock, thank you for joining me today.
My pleasure.
Of all the pressures that are on the current healthcare system today, what impacts your members, the for-profit hospitals, the not-for-profit hospitals, what impacts them the most in a negative way?
Well, I think it's definitely the lack of coverage for so many Americans who need care but don't have the financial resources. They appear at the hospital for care, often in the emergency room. We take care of them, want to, but also have to by law, so there's no turning anybody away. But it creates an enormous economic impact on the organization to care for the uninsured. That results in the need to find that payment someplace else, which leads to the cost shift onto other payers. So the lack of coverage or the lack of payment under public programs, lack of those programs, Medicare and Medicaid in particular, paying less than $1 for a dollar of care received. So those two things really add up to the financial challenge.
And so when there is a new administration in Washington beginning next January, what would your organization's first priority be to present to the president?
It would definitely be coverage. We really believe that you won't fix this system from a lot of different viewpoints unless you have everybody covered and everybody able to access the right care at the right place at the right time. That's obviously not hospital emergency rooms, pardon me, but they often show up there because they can't access a primary care physician's office or some other location.
So universal coverage.
Yes.
By what means?
Well, we're wide open. We think that at the moment, what most people don't focus on is that everybody's paying for care. There's no dollar of care that's provided that doesn't get paid for somehow by someone. They're very shifting kinds of targets to figure out where those dollars come from. But we think that if as employers, as individuals, and as the government, we get realistic about the issue that it's really not whether or not care gets paid for, it's the best way and the most efficient way with the right incentives to provide that care. And so we think that you have to change many aspects of the system. You have to change coverage. You have to change the orientation towards wellness. You have to change the cost structure. You have to improve quality. And you have to have the information you need to provide the opportunity for patients and clinicians to make the right choice at the point of decision. So our focus is on comprehensive reform. Even though we believe that coverage and cost are leading challenges, you can't address those two without addressing the structural problems of the system. So comprehensive reform over some period of time towards some blueprint that we agree on for the future is what we think we need.
What do you think is, what is the reality check here for what you call comprehensive reform? It's been tried before. It has failed before. Making big changes at the federal level to the healthcare system is very challenging. The economy, as we speak, is in trouble. So what are the chances?
Well, I think it's only a matter of when. It's not a matter of whether or not it's going to happen. It has to happen. We can't sustain the costs of this system on into the future the way it's currently organized and incented. So it's a matter of when. Now, maybe we've been thinking about this too simplistically, which for as complex
I think that's impossible.
For a complex subject like healthcare, almost sounds ridiculous. But in all seriousness, if you look at other areas of change within our nation over the past couple of decades, if you said the environment, clean water, clean air, people would say, my goodness, that's enormous. That you're talking about infrastructure changes, regulatory changes, incentive changes, some policing and some self-responsibility, media campaigns. And in fact, you look back over time and the strides we've made in environmental issues have taken parts of all of those realms of strategy. We're going to have to do the same thing in healthcare, but we talk about healthcare as though it's a single topic as though it can be fixed in a single bill, and then we argue over the ideology that's going to drive that bill. It's much more complex than that. But I think if we look at some other major areas, we could see that in fact it's been a multi-pronged approach. And if we had a better blueprint, I think we could agree on what pieces have to fall into place over time. But we haven't even gotten to the blueprint discussion.
So are you saying that we need to get the blueprint to build the whole house, but then build each room as we go to do it in a kind of piece part way?
Probably like you'd build a house from the bottom up, from the foundation. And I think foundational issues definitely are coverage issues. Again, people can't access the right care at the right time, and that's a fundamental problem. So they start to access more care that's more expensive because it's, the condition is more advanced and the location is more expensive. We do have a culture in America that says more is better in healthcare, and the data is starting to show us that that's not the case. So let's dial back our expectations, get a good foundation, coverage, access to primary care, an orientation towards prevention, maybe even a business case for prevention, something we don't have right now at all. It's all towards treatment. So you got to get those foundational pieces in there.